Hello to our Gold Learning viewers from around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC for Gold Learning. Well, I have the pleasure of chatting with Dr. Yvonne LeFort today, and she's going to be speaking for us at our upcoming Gold Learning Online Tongue Tie Symposium 2017, which is titled Putting the Pieces Together. It's going to be a symposium of lots of speakers coming on September 18th. Yvonne is going to be speaking to breastfeeding friendly approach to tongue tie. Welcome, Yvonne. It's so great to have you here today.
Thank you, Fiona. It's great
Well,
to be part of this.
yeah, thank you. I'm excited to hear so much about this breastfeeding friendly approach to tongue tie. Being an IBCLC, of course, this excites me, and so I can't wait to hear what you have to teach us. But let's have you introduce yourself to the audience right now. Perhaps you could start by telling them a little bit about yourself and what you do on a day-to-day basis, Yvonne.
Well, thanks, Fiona. I'm actually a family physician, so you can tell by my accent that I'm not originally from New Zealand, and I am Canadian and Canadian trained, but I've spent most of my professional life working in New Zealand. So I work in general family practice, but as a special interest over the last 19 years, I've been involved with breastfeeding medicine. So within my clinical practice, I'm actually the medical director of a breastfeeding clinic in Auckland. And we see breastfeeding dyads with various problems from around the greater Auckland area, but have had an interest particularly in tongue tie management through those years. So we get specific referrals, not just for breastfeeding problems, but for assessment of tongue ties.
Excellent. Well, that's great to hear, and I know that you are somewhat of a neighbor. I see that you went to University of Calgary, and I live currently in Edmonton, so we weren't that far apart. But now you live in beautiful New Zealand, which is also a beautiful country too. Well, thank you for letting us know a little bit about what you're doing. But perhaps you can back up a little bit and tell me when and how did it become important for you to sort of start researching and treating tongue tie?
Well, Fiona, I actually trained in family medicine in Calgary and had worked in Calgary for years over the last 30 years of my professional life. And when I was in Calgary in the late 1990s, I became acquainted with Dr. Evelyn Jan, who set up probably the very first breastfeeding clinic in Canada. And her interest in tongue tie inspired my interest in tongue tie. I actually worked with her for a few years. And after I left Canada and came to New Zealand, I wanted to continue my interest and continue my skills and really progress my skills in this area. So I continued my interest, and here I am.
Yeah, here we are today, I was going to say, because before you know it, it probably has it's sort of a bit of an entity of its own because it really is exploding right across the map. We're starting to see lots of different things happen, research, different types of practice, and I guess that's part of what we're doing here at Gold is bringing professionals together and so that they can talk about it from their perspective, what they're doing in their different countries. So it really is, it's an exciting time, and I know it's overwhelming for so many of our families. And I think even as, IBCLCs, we see a lot of it, and we just want to do better and right by our families. So I'm excited that you've taken the time certainly to, research this and look at it. And I'm excited to hear what you have to say on the day, Yvonne, which brings me to sort of your actual presentation, which is breastfeeding friendly approach to tongue tie. So this is a very interesting topic to me, and I don't know much about what you're going to be talking about yet, but perhaps if you could just dive a little bit into that and maybe just share a snippet of what you're looking forward to sharing with our delegates.
Well, as a family physician who's been involved in breastfeeding medicine, the tongue tie issue has been with me since day one, but it's not the complete picture that we actually look at all clinical problems relating to breastfeeding. So I think my situation, I work with an IBCLC, and we together approach the breastfeeding mother and infant when they come to us with breastfeeding problems. So we provide tongue tie releases, but we approach it in a way that we support the complete picture of breastfeeding, and we're very shall I say, careful in our assessment that the major focus is to protect and promote breastfeeding. So I'm interested in and very excited to share this with other people that may be wanting to set up a clinic or a service for breastfeeding mothers and include in that tongue tie management.
Oh, absolutely. I think this is something that I think we're starting to see this in a lot of places, Yvonne, and it is very exciting. But there's obviously there's not enough happening right now. I know in my hometown that, we have a family physician who's working with a lactation consultant, but one of its kind, where there's that collaborative type of care. And wouldn't it just be wonderful to see this explode, for everywhere for our families, because we know that when you look at the bigger picture, which is always hard when you don't have all the information. But I know that hopefully that's what you're going to be sharing with us. I think there's going to be some of that in your presentation. And I'm so glad and appreciative that you've been able to get this going where you are. And again, this has just been, seems like this has been part of your life for quite some time. So I'll look forward to hearing more. I'm assuming it's at the Milford Breastfeeding Clinic. Is that correct? I see it on the screen here, Yvonne.
Yes, that's our practice at the moment, and it's myself and one IBCLC, and it wasn't always. I should mention that I've had many years without working with an IBCLC, and that's part of my reason for really promoting this approach is that I feel that incorporating the immediate help of the IBCLC has been a tremendous benefit to the success and to the furthering the promotion of breastfeeding and protecting breastfeeding.
Excellent. Well, thank you so much, Yvonne. It's been lovely hearing from you and having you here. And for our audience listening in, quick reminder, our Gold Learning Online Tongue Tie Symposium 2017, putting the pieces together live on September 18th. You can go to goldlearning.com to register right now to listen to Yvonne and our other speakers, of course. I'll look forward to having you back on the day, Yvonne, and of course, feeding off of all of your information. I can't wait to hear more. And then, of course, sharing it with our colleagues as well, which is going to be so important. Thank you to Yvonne for being here. And thank you to our listening audience. Once again, this is Fiona Lang Sharp, and we'll look forward to seeing you all online. Bye bye for now.